Brian, let me just start with you and give me the state sort of as you see it, not just in the states where you operate, but giving you also the American Hospital Association chair. What are you hearing from your peers in other states?
I'll start there, and it's interesting thinking back to last March when we were here. We are seeing this virus surge a lot around the country, and that's the difference between now and back in the spring, where it was isolated pretty much into a couple of areas, including the tri-state area here. Here in New Jersey, over the last 3 or 4 weeks, we have really seen the virus pick up. It is broad in New Jersey, but it varies by region. And within our hospitals and health systems, we've seen admissions increase over the last 3 weeks. We went from a high in April to over 900 patients a day in our hospitals. Today, we have about 170, and 3 weeks ago, we had 20. So clearly, the virus is back.
Dr. Reich, to you as well. I know, obviously, listen, New York, things are not going in the right direction in New York and New Jersey, but they are better than a number of states in the country right now.
Yes, certainly we've seen more than a doubling in the past 2 weeks statewide, a little bit less in the New York City region. But we're very concerned about what's going to happen in the weeks to come, especially if we're not successful in communicating with families that the Thanksgiving holiday has to be treated very differently this year, because this is a virus that spreads so well indoor at meals, and so we have to think differently for the holiday season coming up.
When we're thinking differently, do you think that the governments need to step in, Dr. Rich, and perhaps put some more restrictions in place? Obviously, New York and New Jersey have tried to limit family gatherings to 10 people or fewer. Do you expect to see more on that front in terms of kind of public health measures put in place? And do they get back to the point that they were in March, April, May in this region?
Well, we certainly expect that public health measures will ramp up a bit in the New York region, and I think the governors of the adjoining states have all come together and are preparing a plan. And so very much looking forward to great leadership from our governments at the state, federal, and local levels in getting that message out there. The public health measures are really all that we have right now. We have mildly improved outcomes related perhaps to therapeutics or perhaps to other aspects of how the disease is managed, but it's still a very deadly disease. And we have to take this cautiously and really do our best to have ultimate levels of compliance with public health measures.
Dr. Gragnolotti, what do you make of the data from Pfizer and Moderna with regard to their efficacy levels?
We're very enthused by the data that we've seen from both companies. We see the seasonal flu vaccine, we're thrilled when we hit about a 70% level. So to see levels in the 90s is just extraordinary and gives us a real sense of a light at the end of the tunnel.
David, I wonder, we saw some FDA approval of a test that you could take at home and you get the results at home. In the medical community, is there broad hope that will eventually be a big part of the equation?
I think the concern that we have with home tests will be related to the sensitivity. That's the number of patients that are found that have the disease, and the specificity, which is the number of patients that don't have the disease. And so the home tests will never be quite as good, but as a public health screening measure, they could certainly serve an important role in achieving control of outbreaks within our communities.
Shepard Smith here. Thanks for watching CNBC on YouTube.